Hello, myself audiologist Himanshu Kumar Sanju. Today I am going to talk about auditory neuropathy. So first of all, let's see what is auditory neuropathy. Auditory neuropathy is a spectrum disorder in which the patient may or may not have hearing loss, but the patient may have problem in understanding speech in noisy situations. So what actually happens in auditory neuropathy is everything is fine till outer hair cell, or you can say till cochlea. So the actual pathology lies at the level of auditory nerve. So everything is fine till outer hair cell, but the problem starts from auditory nerve. So what the actual problem at the level of auditory nerve? The actual problem is in the synchronous firing of auditory nerve. So as we all know that the nerve firing should be synchronous, like all the nerves should fire at a time. But in the patients with auditory neuropathy, the synchronous firing of auditory nerve gets disrupted, and that leads to the problem in understanding speech in noisy situations. So these patients may complain you like I have no issues in understanding speech in quiet situations, but I found a lot of hearing trouble in the noisy situations, like if they are in crowded situations like bus stop, railway station, or in classrooms. So in that condition, if you check or if you do a hearing assessments like Peotone audiometry, you may get a normal hearing. But you should be cautious while diagnosing patients with auditory neuropathy. So, as an audiologist, we do a series of tests to find out or to diagnose the patients with auditory neuropathy. So, let's talk about the prevalence of auditory neuropathy. So, according to the research, the prevalence of auditory neuropathy lies between somewhere between 1 to 10% of hearing impairment population. So now, as an audiologist, if I try to diagnose, or if I want to diagnose a patient with auditory neuropathy, I will do a series of tests like tympanometry, reflexometry, autoacoustic emission, auditory brainstem response, cortical auditory evoked potentials. So I will do all these tests, and after having the information, after having all the information from these investigation, I will come up to a diagnosis. So let's see what can you expect in the patients with auditory neuropathy. So as I told you earlier, that like whenever you do a Peotone audiometry, you may get a normal hearing. When autoacoustic emission, you may get normal autoacoustic emission, or in some patients you will get much more of autoacoustic emission. That may be because of some other issues. Sorry, not issues. That can be because of some other thing that is not a part of this video. Then, as soon as you will get a very nice OE, autocaustic emission, very good OEs. After that, we do auditory brainstem response. So in auditory brainstem response, you may find either complete absence of ABR or reduced amplitude of fifth peak. So that can be a possibility, like the patient have normal autocaustic emission but no ABR. In that case, you may suspect a patient with auditory neuropathy. We also do cortical auditory evoked potential. In another word, we say it as LLR, that's called long latency response, just to check out the severity of auditory neuropathy. For example, if ABR is absent, but when you do LLR, if LLR is present, in that case we say the severity of the problem is less. But suppose if your ABR is also absent and your LLR is also absent, in that case you can say that the severity of auditory neuropathy is very high, is much more. So, based on the finding, you can plan your treatment. So, let's come to the treatment of auditory neuropathy. So, once you confirm that this patient has auditory neuropathy, you can plan for the treatment. So, the first treatment option is basically a hearing aid. If a patient have hearing loss, in that case, you can go for a hearing aid. The another option is cochlear implant. According to the recent research, the researcher have shown that the cochlear implant is also a good option for the patients with auditory neuropathy. The third option is personal FM system. So if a child have normal hearing, in that case, you can ask them to go for a personal FM system that will actually enhance signal to noise ratio. So if a child have auditory neuropathy and if a child is facing lots of problem in classroom situations, in that conditions, a personal FM system is going to help a lot. So these are the treatment options for auditory neuropathy. So I request audiologists to be cautious during the diagnosis of auditory neuropathy. So if you want to diagnose, if you want to confirm that this patient have auditory neuropathy, in that case you should must do pure tone audiometry, even the speech identification score like your SIS score or speech discrimination score. Tympanometry you can do. Reflexometry is also one of the most important tests. Then autoacoustic emission, auditory brainstem response, and LLR, you can say it as a cortical auditory evoked potential. So you do all these tests and then come up to a diagnosis or come up to the diagnosis of a auditory neuropathy. So one more interesting thing you can see in a patients with auditory neuropathy, like usually if you correlate the finding of pure tone average to your SRT and or SIS, it correlates well. But in the patients with auditory neuropathy, the pure tone average will not correlate with your speech recognition threshold. Your speech recognition threshold will not correlate will not correlate with speech identification score. So you can see that there is a poor correlation in pure tone average and speech tests. So that's one of the way you can help. It can help you while diagnosing the patients with auditory neuropathy. So because as you know that it's like a pure tone is easy to detect, but speech, but if you are doing SRT or SIS, the person supposed to understand the speech stimulus. In that case, the patients with auditory neuropathy may find a lot of trouble. That's the reason of such a poor correlation between pure tone average and speech identification score. So it's the auditory neuropathy was first described by A. Star in 1996, and here also in our clinic we diagnose lots of patients with auditory neuropathy because diagnosis is one of the most important factor for a better treatment. So if your diagnosis is not clear, it's very difficult it's very difficult for an audiologist to treat their patients. So yes, you should be cautious while diagnosing the patient with auditory neuropathy, and at the same time, you should also use a test battery approach when you want to diagnose a patient with auditory neuropathy. Thanks a lot. Thanks a lot to all audiologists. See you in next video. Okay, thank you.